So in my office, a lot of patients ask me questions about breast augmentation and its safety. There's been a lot of news in the media over the years about this. And the reality is breast implants are safe. Most of them are FDA approved for use in breast augmentation. And lastly, breast implants themselves do not cause cancer. But the one important thing to remember is textured implants, which I don't use, are linked to a rare form of cancer called breast implant associated ALCL. So the next question is, a lot of patients ask me, well, what is this breast implant associated ALCL, or otherwise known as anaplastic large cell lymphoma? Well, like I said, textured implants, certain types of implants, are linked to a very rare indolent form of cancer that develops, late or 10 years after the patient has implants. Typically it presents as a seroma, meaning a collection of fluid, or there's some change that the patient sees in their breast to prompt them to have an evaluation. My only advice is, if you have implants and you have any sort of visual problem or you see some type of fluid collection, to just get it evaluated by a plastic surgeon. So here's the reality. A lot of patients come to my office and they ask, what breast implant should I get? Here's one of the company's profiles. You can see that there's so many different implants, so many sizes, it's impossible to choose. So what I do in my consultations is I try to help the patients and kind of guide them in picking the best size that'll help fit their expectations and fulfill their needs. One of the most important things I do, first of all, is measurements. And in plastic surgery, measurements and marking is very important and vital to having the best outcome. The second thing is we have different imaging programs as well as sizing kits to help patients decide which implants they like the best. It helps them decide what profile might work for them, what size might work for them, and they're able to compare and contrast with women similar to themselves. So in my consultation, a lot of my patients are very active. After breast augmentation, they want to know when can they go back to the beach, when can they go back to working out. Well, here are my guidelines, and I always tell my patients, it's always safety first, and I want you to have the best outcome possible. So I know some of my patients, they're really dying to get out there to do core power yoga or Peloton. I tell them you've got to at least wait 6 weeks before doing any heavy or strenuous exercise because we don't want any complications with the implants. Second thing is, of course, they get breast augmentation. A lot of patients want to go to the beach, they want to go on vacation. And I tell them, there's no problem going to the beach, but getting in the water, I also recommend waiting 6 weeks because I want to make sure that the implants are settling properly and all the wounds heal well. So a lot of my breast augmentation patients are very young and they're thinking in the future that they'd like to have children, they may want to breastfeed. And I tell them breastfeeding is still possible after having implants. There are no issues with that, and it's something that I don't want them to worry about. So most of the breast augmentations I do, I actually place the implant under the muscle. I believe that placing it in that particular pocket or location gives a longer lasting and more natural result. There's also a lower rate of complications. So in essence, I believe it's the best position or pocket to put the implant in. So a lot of patients ask about when they should replace implants. Sometimes they do internet searches and it says 10 years. The only thing I can really assure a breast augmentation patient is you're probably going to need a surgery at some point. It all depends on each particular patient and what happens with their implants.